Hi, I'm Trish. I'm going to give everyone fair warning. I might cry. It's not even because I'm sad, it's because I'm really fucking tired because I haven't slept more than a couple of hours the last 2 nights. I am fucking beyond it, but I wanted to get this video out, so it's probably going to be a real big mess, but let's see how we go. And the reason I haven't slept is because my back is, it's just next level hurting, my lower back. I don't know what's happened. I know it's something to do with the hysterectomy and all the laying around I've been doing, but I don't know. I've got to talk to my doctor about it tomorrow. I took 3 endone last night. Still only slept for about an hour. It's absolutely crazy. So anyway, yeah, so this will be an update about my hysterectomy that I had last Thursday. Today it's Wednesday. Other than the back pain, I'm doing really, really well. I am resting. I am 1,000,000% resting as much as I have to. I'm doing the whole laying down flat for an hour every day. I'm eating as well as I can. I didn't eat. Yesterday was a nightmare. It was awful. But yeah, I'm eating pretty well. Managed to lose weight. I've lost centimetres off my waist and hips and my belly. But anyway, I'll start at the start. This is already shaping up to be absolutely brilliant. Start at the start. So last week on the Thursday, I went into the hospital. Had to be at the hospital at 10:30, and they did all of their things that they do. You know, they check your blood pressure, and you see the anaesthetist and the nurse and the surgeon and everyone. I think I was in theatre by about 1:30, I think. I think my surgery took about 2 or 3 hours, not 100% sure. I think I was in recovery for about an hour, back on the ward. I don't know, because I was all, full of the drugs and everything. I think I was back on the ward by about 6 or 7. My daughter was there to look after my sorry, pathetic ass. I'm really bad after a general anaesthetic, and I do like to have family there to just watch me and make sure I'm breathing and hold my hand and pat me and just let me cry and that, and I normally do a little bit. I'm not real good coming out of general anaesthetics because I feel very woozy and very sick and very trapped in the bed because I can't get out of bed because I'm too woozy and my blood pressure's too low and all that sort of thing. But that normally only lasts for a few hours and then I'm okay. I go to sleep and I'm fine. The surgery, I don't have a surgical report yet, but as far as I know, the surgery went fine as planned. It was all keyhole. I've got 4, I think they're just stab wounds on my tummy. I haven't seen them yet because the dressings are still on. I'll show you what I've got. And on top of all my sleeve wounds, my belly is a real war zone at the moment. Oh, look, my undies match my dress. So I've got one down here. This massive, great big, look how fat that dressing is. I don't know what they've done to my belly button. I'm a little bit scared to see if it needs a dressing like that. I've got this one and this one down here, which doesn't have the white dressing on it because that one got wet a couple of days ago. It's only got the Steri-Strip and I put some Tegaderm over the top of it. So it's all looking pretty good. Definitely a war zone belly now, but I don't mind that. They're all my stories, interesting stories. Yeah, so they took my uterus, my cervix and my fallopian tubes. I've been assured that my ovaries are still in there, and as I haven't gone into surgical menopause overnight, I tend to believe that my ovaries are actually in there. My daughter came through like that. She came to the hospital with me and she went through the whole process of seeing the nurse and the anaesthetist and everyone. And I was, I held it all together. But then as soon as, because you get to a certain point in the process where your family can't come with you anymore. And there's at Frankston Hospital, there's a pre-op ward. And they got me into the ward and I started crying and, the nurses were really lovely. They came over and they go, a little bit upset there, dear. And I'm like, yeah, I'm sorry. Do you know what I was getting overwhelmed by? A lot of sex stuff. This is what happens to me. Not the sex stuff all the time, but when I've got a big surgery coming up, I don't really focus on getting upset about so much about things that can go wrong with the surgery, you know, like dying on the table. I get upset about other completely irrelevant shit. Like a couple of years ago, I think it was when I had my breast reduction done, I pitched a fit because I couldn't wear nail polish. And that is 1,000,000% as ridiculous as it sounds. So this time I was getting stressed over sex. And I guess that's understandable because they were messing with my sex bits. Not that any of my future partners will ever know, but I do. And so I'm laying there, and I didn't tell anyone what I was crying over, but I'm sitting there, and this is completely, utterly ridiculous because I didn't even take my ovaries. This isn't going to happen because I've still got my ovaries. I was laying there and I was thinking, and I was thinking about like the last time that I had sex, which was a really fucking long time ago for me. And I was thinking, what if that was the last time I ever have sex without having to use lube? Because, like, you know, when you go through menopause, a lot of women, they get very dry down there and they need to use lube. I've never had to use lube in my life. And so I got really upset thinking, what if that was the last time that I ever had sex without using lube? And I was crying. How ridiculous is that? And I spent, you know, like the last week or something before my surgery missing this guy that I had this thing with, when it's just absolutely ridiculous. It's been over for long enough that I shouldn't be sooking over it anymore. And, you know, and it's really over. Like, there's no point getting upset over it anymore. But I needed something to get sooky over, so that was it. But I just get upset over ridiculous things. So anyway, I got into the surgery. The anaesthetist came because I get very anxious about them putting an IV in because my veins aren't good. And so it's usually, it can be quite a few sticks and bruises and pain and a lot of stress for me. It's I mean, blood tests and stuff I'm fine with, but when it comes to an IV, because they've got to get a good vein, I get very, very anxious about that. So I had two anaesthetists come, and they were both so lovely and patient and understanding. They gave me some oral midazolam. That is a happy juice they give you before you even go in for surgery, and it's wonderful. It's really wonderful. So they gave me some of that orally before they even put the IV in, and then the anaesthetist actually put a paediatric IV in my good blood test vein, just so that they could then get a bit of the, I think they gave me the propofol, which is the actual general anaesthetic drug. They gave me a hit of that, and then they put me, and then that makes you really woozy. That makes you think you're really, really funny, cracking lots of jokes. I don't know, I probably hit on him. I don't even know. I know that there was a student, must have been a student doctor there, and she came in, and because, you know, when you're in a public hospital, it's a teaching hospital, so there's always going to be students hanging around. I had a lot of student nurses and all this sort of thing, and they normally hide their excitement because they've got to ask your consent to do things to you and to be present in the surgery and all this sort of thing. So they normally hide their excitement. They're normally really cool about it, but this one girl, she was overexcited, and I thought it was so cute. She came in just before I was wheeled into theatre, and she came in, she asked me, and she was very polite, but I could just see she was just over brimming with excitement. And she said, would it be okay, you know, she explained who she was and that she was a student and whatever, and she said, would it be okay if I did a vaginal exam on you? And I was just, because I'd already had the drugs by this stage, I'm like, that's fine, bring all your mates too, I don't care. And then she was really excited, and to be honest, even if I hadn't had the drugs, probably wouldn't have asked her to bring all her mates as well. But I would have said yes, because they need the practice, and I've been there. I'm a pathology collector. I do blood test. Well, I would do blood tests if I could work, and I know what it was like for me, having to have people volunteer to let me, a learner, stick needles into them. So I always say yes. So, yeah, the surgery went well. I don't remember really much after that. I sort of remember going into theatre and, you know, shuffling over to the table and whatever. But I was just, by that stage, I just want to be out. I just want to not be there anymore. So after they put me under, they put another proper IV in me, just down in my wrist this time. Didn't even get a bruise. So I don't care where they put the IV once I'm out. I don't really recall being in a lot of pain when I came out of the surgery, but I was very woozy. And they gave me, I'm going to say they gave me ketamine. I did speak to the anaesthetist before it, and before I went in, and told him, because I've got a lot of allergies to drugs and stuff, and I have had ketamine before, and it makes me hallucinate. Now, the last time I had it was a very long time ago when I had open gallbladder surgery, and I did hallucinate, but it was fun hallucination. So there was jars of peanut butter dancing, and everything was all really psychedelic, like what you see on the movies and stuff. It was fun. I knew I was hallucinating. I was fine with it. But I'm going to be saying to every anaesthetist for any future surgery, never, ever, 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 ever give me never, ever, ever give me ketamine again. And I'll probably be saying don't give me fentanyl either, because it makes me stop breathing. And I'll be saying that because once I got back to the ward, and I was sitting there and I was sort of like talking to my daughter, I was all groggy and woozy and everything, and I looked down and like the bed sheet was up around here, and I saw with my eyeballs this fucking fat, hairy tarantula that was about this big crawling up the sheet towards my face. I saw that with my eyeballs. Now, I knew that I had probably had ketamine, so I knew that it probably wasn't real, and it was only sort of like crawling up like my chest for maybe 2 seconds, but certainly long enough for me to see. And I'm deathly scared of big spiders. And then it just disappeared. As I was looking at it, it just cut out. I'm never having ketamine again, because I can't. Just the thought of having another bad hallucination like that. No, so that won't be happening again. So yeah, anyway, so I was taken back to the ward, and I was just woozy and whatever. The pain was very manageable. They actually had me on a fentanyl pump, which I only used once overnight, because I'm a bit wary with fentanyl, because as I fall asleep it does suppress my breathing and I stop breathing. So I'm, you know, like as I fall asleep and then I wake up and I'm like gasping for air. So I did only use it the once. I'm pretty sure I had Panadol though, and I would have been doped up with other painkillers from the surgery, and I was quite comfortable. But yeah, I used it the once, my breathing stopped, and I thought, no, I'm not using it again. And I knew in the morning they'd be bringing me oxycodone, oral pain relief. So I made it through the night. I was very, very pathetic. I was actually crying without tears. Second time in my life. Second time ever in my life that I was crying without tears, and I was just so pathetic, and I didn't care. And my daughter was just, you know, patting me and loving me, and the nurses were coming in and checking on me, and thank God I had a private room. I was a public patient, but even as a public patient, sometimes you get a private room. So I was lucky I had a private room and wasn't bothering other patients with my pathetic crying, which I think went on for a while. I had a catheter in, so I didn't need to get up to go to the toilet through the night. So yeah, then I think my daughter ended up leaving about midnight. She was just so patient. She just sat with me, and I was a bit sort of hungry, so I asked if I'd get some food, and so they actually sent down to the kitchen for me, diabetic menu. They brought up what looked like an entire chicken breast with mashed potato and gravy and steamed veggies, and it was a beautiful meal. And this big bowl of fresh fruit and an orange. But I just, you know, I took the cover off the meal, and I just thought, oh, I can't eat. I can't even touch it. I can't stand the thought of eating. I just felt too sick. So that went away untouched. I should have just given it to my daughter to eat, because she didn't have dinner. But, you know, I wasn't thinking straight. So in the morning, they gave me some oxycodone, endone, just the slow release stuff. It lasts for 2 hours, and that was enough to... there was enough pain relief for me with Panadol. a student nurse came, and they're always supervised, so like with another nurse, student nurse came, and the proper nurse, my regular nurse, she asked if it would be okay if the student nurse removed the catheter. And I've had catheters before. They don't bother me. They don't hurt. They feel a bit weird coming out, but they don't. I know there's nothing to be scared of. So I said, yeah, sure, that's fine. And she was really excited as well because it was her first catheter that she'd ever done. So my catheter came out, and then I was allowed to actually get up out of bed and go to the toilet. And I felt fine. I didn't need any assistance or anything. And I've had enough surgeries, I know, to sit on this side of the bed and, kick my feet around and everything to get the blood flow going so that I don't get faint. I had to do what they called a trial of void, which means I had to, drink lots of fluids as much as I could tolerate and do 3 wees over the course of the day. And they, compare what my intake was compared to my output and make sure that everything, my kidneys and my bladder and everything were working properly. The first 2 times I went to the toilet, I just went because it had been a couple of hours and I'd been drinking, and I figured I just had to, there had to be something in there, and I only voided 200 mils each time, and I didn't feel like I needed to wee, and my bladder was emptying pretty well because they do an ultrasound afterwards as well to make sure that there's nothing left in there, and there was a little bit left in there, but that's normal. But by the time I got up to go the 3rd time, I actually needed to go to the toilet. And I think I weed about 6 litres. There was there was so much wee. So they went, okay, well, you've passed this trial of void, everything's okay. I didn't have any drains in this time, so I didn't need any of those removed. I think I just had endone that first full day, the Friday, and then I think I had some when I went to bed as well. And then from the Saturday and the Sunday, I think I only had Panadol. I ended up being in hospital for 3 nights. The food in hospital, diabetic menu, it was fantastic. Really, really good food. They bought me crumbed fish, so I didn't eat the crumb. Just ate the fish, and I really didn't have much of an appetite at all. I was eating very, very little. I was finding it very hard to get fluids in because I just felt so bloated. But that can be completely normal after surgery. So I was just eating what I could and drinking what I could. And I got up every now and then and went for a little walk around the ward because I'm deathly scared of getting a DVT. I had to have Clexane injections each day in my thigh, and they really hurt in your thigh. When they put them in my belly, it's just like a hot knife through your body. You don't even feel it. It doesn't sting. It's fine. But when they go in your thigh, not the needle so much. That doesn't really hurt because it's a very slow needle. It's very small but very slow. They sort of pinch your skin up and they put it in, and then they push the medicine in, and then they leave it in there for a second, and then they take it out. You don't really feel that, but once that needle comes out, then it really stings, and you can't rub it because then you bruise and all this stuff. But I've had those before. I knew what to expect. I showered. I think I missed 1 shower one day because after 2 nights I was meant to go home. The doctor came and she said, I think you can go home now, you should be fine. But I got up and I went for a walk around the ward, and I really didn't feel well. Really, really, really didn't feel well. And the nurse came and she did my blood pressure. My blood pressure was quite low. It was only 100/70. And so I spoke to the nurse, I spoke to the surgeon, and I said, would it be okay if I stayed 1 more night? Because to be honest, with me feeling like this, if I go home today, I'm going to end up back in emergency tonight because feeling like this makes me very, very anxious. I'm going to be having panic attacks and whatever. And they said, yeah, that's fine. If you need to stay another night, you stay another night. We're not forcing you out. If you need that, you need that. So I stayed the extra night, and it was really 100% the best thing for me to do. I feel every other hospital admission I've ever had, I get forced out, or I feel like I'm being forced out a day earlier than what I need. And that might just be because I'm a little bit needier than other people and a bit more anxious and everything. But I felt this time just that 1 extra night really made a difference. When I went home after the third night, I felt ready to go home. I felt, you know, as good as you can. So that was definitely the right thing for me to do. I did have, on the first day after the surgery, because a surgeon came around to see me, and I asked him if I had packing inside my vagina, because sometimes after a hysterectomy you have packing. And he wasn't sure because he didn't do the surgery. So he did an internal examination on me the morning after my surgery, and I'm just laying there and I'm like, wasn't ready for this. What if this hurts? What if it... I didn't know what to expect. So he did an internal examination. It was very quick, and it didn't hurt at all. I was sort of like ready for it to hurt, but it didn't hurt at all. So, you know, other than feeling quite shitty when I came out of surgery, and a little bit crappy after 2 nights, it was a pretty uneventful stay. It was, you know, all the staff were really, really lovely. I was sort of up and walking around. I was, you know, I had good food. I was showering by myself. Showering was wiping me out, still wiping me out now. Like, I had a shower this morning and then went and, you know, sat on the side of my bed for a while before I got dressed. But, you know, I mean, you can see I've managed to get up. It's my sister's birthday today. She's turning 40. Happy birthday if you watch this video. I know you don't watch all of them. So we're going out for lunch, but that's all I'm doing today. Oh, actually, I've got to go and get a stat deck done, but I've just got to... My daughter's going to drive me up to the shops. I'm going to go into the post office or the newsagents, get some photocopies, and then I'll go a couple of doors down. I'll go to the chemist and get the stat deck signed, and then my daughter's going to drive me to lunch, and I'm just going to sit there. I'm not going to have to do anything. She'll go and order my food. She'll bring my food to me. Everything will be fine. And then I'm going to come home and I'm going to rest. I'm going to lay on my belly and rest. And that's something weird as well. In the paperwork that they gave me for the post-op stuff, you're supposed to lay down like flat for at least an hour each day. And in the picture, there's this chick laying on her belly after a hysterectomy with a pillow under her tummy. And so I thought, well, I'll give that a crack, because I've been sleeping on my tummy. I slept on my side the first night, and then when I got home, sleeping on my tummy, and it's really comfortable. I put a hot water bottle like under my hips, and I lay on that, and that is really, really comfortable. I think that's all. I've got my post-op appointment with the surgeon in 6 weeks. I did pop in to see my GP yesterday. Oh yeah, that's what happened. I lost 400 ml of blood through the surgery, plus because I'd been bleeding quite heavily leading up to the surgery, my hemoglobin has dropped down to 90, and it's meant to be at least 12. So my hemoglobin is quite low, which means that my iron will be quite low, and because I've had a sleeve gastrectomy and I can't eat enough food to get my iron levels up fast, and because I can't tolerate iron supplements, I've got to have an iron infusion. So I saw, not my regular GP yesterday, but there's a clinic where I go to and I see lots of the doctors there. So I had another blood test yesterday to check my iron levels and my hemoglobin and my potassium. I'm always getting my potassium checked now. So I'll get the results of that on Thursday when I go back to the GPs and see the nurse, and I've got external stitches. I've got to get stitches removed, but that doesn't bother me, that doesn't hurt. So if my iron is low and my hemoglobin is still low, I will have to have an iron infusion, and I think that my iron infusion GP will do the iron infusion even if my levels aren't terribly low, given that I can't get my iron levels up via other means fast. And I'm feeling a little bit crappy. Not as crappy as I thought I would be with having low hemoglobin and low iron. I'm really only feeling so shit today because I haven't slept predominantly for 2 nights. I'm going to lose my mind if I don't sleep tonight. Okay. Oh, another weird thing happened. Not last night, but the night before. Before I went to bed, My daughter was, she's a bit of a cock blocker, that one. 24 years old, tries to dictate to me when I can and can't have sex. So she's really keeping an eye on me to make sure that I don't see anyone before the 6 weeks is up and I get clearance from the surgeon. So she was giving me a bit of a lecture about, don't, you just got to keep it in your pants, don't have sex and blah, blah, blah. And I said to her, Zoe, sex is the last thing on my mind at the moment. I've just had a very big, very major surgery. I am not even thinking about sex. That is not on my radar at the moment, and I don't even want to talk about it, because if I talk about it, my brain's going to start thinking about it, and I don't even want to risk thinking about it and getting horny. I don't want to go there. So you don't need to worry. Nothing's going to happen. That little seed got in my brain, and I had a sex dream that night. That 2 nights ago, on what would have been day 5 after surgery, after having a hysterectomy, I had a sex dream with a happy ending. And as I was waking up, I was thinking, no, it's too soon. Oh no, because once that train leaves the station, that's it. There's no stopping it. You can't sort of get halfway through and go, you know what, this hurts a little bit. I'd like it to stop now. But nothing hurt. It was only a little one, but nothing hurt. So, and apparently, because I've been talking to a few people, it's really common for ladies to get horny as fuck after a hysterectomy, and early days. So I'm not even a week out yet, so I'm not going to be doing anything about it, but probably in the next couple of days, to be really honest, because I know in myself, once this sex brain starts up, I'll be having sex dreams every night, and I can't even have sex for at least another 5 weeks, so business will need to be taken care of. It's a therapeutic means. That's all it will be. Like physio. Oh, and I've been doing physio as well, because I looked up some exercises for this back pain. So I've been doing some hysterectomy friendly, very gentle exercises that don't engage my core or my pelvic floor. They don't seem to be helping. They feel good when I do them, but they're not helping yet. And I did them 3 times yesterday. And I've tried everything. I've tried sleeping on my sides and my back and my belly, and with a pillow under my knees, with a pillow between my knees, and just I don't know what to do. I don't know what to do, but I'm going to go crazy if I don't get some sleep. I had endone last night. Tonight, and it didn't really, it barely even took the edge off. Tonight, I might take some Valium in case this is a muscle spasm thing. And that will relax my muscles. And I'm certainly not going to be doing that every night, but if that works, I'll know that it's muscle spasms. And my nose is getting drippy. And I've got my phone sitting on the tissue box. So I'll take the Valium tonight as an experiment. And if it is muscle spasms, that'll get rid of it. That might actually fix it. Otherwise, I'll try to get an emergency appointment with my osteo or physio or something and see if something can be done. And just on the really horny stuff, like being horny this fucking soon after a hysterectomy, which is ridiculous, my theory is that because I've had surgery in that area, there's increased blood flow and swelling inside, which is probably just making my body think that I'm horny, because it's the same sort of, like when you get horny, all the blood rushes to that area. So my sex-starved brain is probably just interpreting that as being horny, maybe. I don't know. And speaking of swelling, I don't really have any swelling as such. I'm a little bit lumpy, but I'm not really swollen. And I lost 1.4 kilos. Actually, I'm down about 1.7 kilos now since surgery. But I am intentionally trying to lose weight, and I've been struggling to eat. Although I have been eating more, because I've been eating more often through the day. Been eating 5 or 6 really small meals throughout the day rather than just 3. and I did my measurements because I was just really curious, and I've lost 1 centimetre off my hips and 3 centimetres off around, I measure around my belly button, and 2 centimetres off my waist. Now, I know that my uterus was a little bit bigger than normal. It was around, at the last time I had an ultrasound, which was last year, my uterus was around about the size of a 10-week pregnancy. So that is not even enough for it to have been like showing from the outside. So the centimetres I've lost doesn't really match up with the weight that I've lost. I would not normally have lost that much centimetres with that small amount of weight that I've lost. But maybe that my uterus was, I don't know, maybe causing fluid retention or something. I don't know. I'm making shit up now. But I'm certainly not swollen, and I think it's because I was wearing the binder. I wore it from day 2 to day 4, 24 hours a day. I have taken it off now. I'll probably put it back on when I go out later. But when I'm just laying around at home and when I'm sleeping, I won't wear it. But if I'm going out, or, going to the shops or appointments, or, going for a walk or anything like that, and I haven't really been for a walk yet. The biggest walk I've had was yesterday. I went to Kmart, and then I went and sat and had lunch, and my daughter went and did the shopping. But I'll probably do that for about the next 5 weeks. And I don't wear it tight. I just wear it just so that it provides just a little bit of support and firmness, and it's very comfortable to wear. So yeah, I'll wear it today. This video is all over the fucking shop, and I'm sorry for that. The next one I'll probably be a little bit more in my head. I'll have a bit more blood in my body and a bit more iron, and I maybe will have had some sleep by then, so it will make a bit more sense. But I'll make another video after I see my GP on Thursday, after I get the stitches out, and find out if my levels are low enough for an iron infusion. And hopefully I'll be able to say I had a full night's sleep and my back feels amazing. So for now, I'm going to go out to lunch and eat about this much food. I was actually vomiting last night because my daughter made me a really nice chicken salad, and I ate too much lettuce, and then I tried to put chicken down my throat on top of that, and I was in so much pain, like with my lower back, and then like my chest was hurting because I ate too much lettuce. So for the first time in 11 months since I had my lap band removed, I was vomiting. It wasn't too bad. It's not so bad when you're not doing it every day. So, and I think that's probably why I'm feeling a bit crappy as well. So anyway, that's really all. I'll check in a couple of days.